what's our schedule look like this morning?
Well, just waiting for our next patient coming in. He should be here any minute. What do we do? There he is! Hello! Oh my God! I'm so happy to be here. It's a beautiful morning, and I am just so ready to help. When can we get started? We can get started right now. How are you today, Mr. Simmons? Fabulous! Okay, we're going to get a measurement of your heart today using the electrocardiogram. So first what we're going to have you do is you're going to need to place the leads on your chest in order to get a correct measurement.
Okay.
Okay, we're started right now. Sound okay?
That sounds fantastic!
Okay, so today we're going to measure the electrical activity of your heart using electrocardiogram. So the first thing we need to do is place the leads on you in order to get a correct measurement. So I need to have you sit down right here.
Okay.
Now are you comfortable taking your shirt off to place the leads?
Am I? With my diet and my exercise and all the love in my heart, I got nothing to hide.
Okay, great.
This video will only be describing lead number 2. However, all leads should be considered when evaluating EKG results as they can reveal important information. The most commonly used is a 12-lead EKG. It consists of 6 precordial leads and 6 limb leads. The electrode placement is shown here.
Alright, so now that we have your limb leads in place, we need to get a measurement of your resting heart rate. So I need you to sit still for just a few minutes so we can see what your EKG looks like during rest. Okay?
Okay.
Alright, that's it.
The first wave is called the P wave. This represents atrial depolarization and contraction and lasts approximately 1/10 of a second. This is the PR interval, which represents the time from the start of atrial depolarization to the start of ventricular depolarization. It indicates the delay of conduction from the SA to the AV node and lasts approximately 0.12 to 0.2 seconds. The QRS complex represents ventricular depolarization and normally lasts less than 0.12 seconds. Atrial repolarization is occurring simultaneously but is hidden by this wave. The ST segment represents the time from ventricular depolarization to the start of ventricular repolarization. It is normally horizontal or upsloping. The T wave represents ventricular repolarization.
Perfect. So now that we have a measurement of your resting EKG, we need to have a measurement of your EKG during exercise.
Exercise? I love to exercise. Do you know what time it is?
What time is it?
It's sweating time. I'm an exercise. Double time. I'm doing fabulous. I'm up. I need someone to come dance with me. Come dance with me.
Even though resting EKG may be normal, increased demands of exercise may bring out evidence of cardiovascular pathologies, so it's important to know normal and abnormal responses. In normal healthy subjects, the R-to-R interval decreases and the QRS complex will be shortened, indicating an increase in heart rate, as is expected with exercise. The ST segment should become upsloping, if not already, and an increase in R-wave height may be noted. Other minor changes may occur with exercise. However, recognition of abnormal rhythms are important. Therefore, EKGs should be assessed for regularity, looking at P waves, the PR interval, the QRS complex, and the ST segment. The morphology of these should be similar in appearance and equal in duration from beat to beat. Specific abnormalities may warrant further medical attention.
Alright, so Mr. Simmons, everything looks great and your heart looks healthy.
I'm so excited, but you know what? I wasn't surprised.
Why not?
Because with a healthy diet and great exercise, and most important, I love myself just like all